All right, hey everybody, it's Ed O'Keefe and welcome to another podcast of America's Leading Experts. I'm here today with Dr. Brian Roadhouse of Regeneration Nation Tulsa.
Yeah,
I got
Tulsa,
that right,
Oklahoma, right?
Yeah, and so that's exciting. So if you are somebody that is paying attention to regenerative medicine or looking at options for how do I get out of pain, how do I restore possible injuries in the past, and or you just want to feel more vibrant as you get older and live younger as you age, maybe is a good way of putting it. Dr. Brian is here today to kind of share what is that on the cutting edge of regenerative medicine, stem cells, and what's available to us. So, Dr. Roadhouse, so great to have you here today.
Yeah, thanks for having me. Thank you.
Yeah. So let's dig into regenerative medicine is booming. It is everywhere you look. You got peptides coming out. We got stem cells being used. Why not share with everybody just kind of what do you see is new in the field that most people, when they think of like whether it's chiropractic clinics or wellness centers, most people aren't aware of what's available to them today.
Yeah. Well, I think we're always looking for something to improve people's health, their lifestyle. It's not just about getting out of pain. It's also doing the things that they love to do and they can't do anymore. And I think that regenerative medicine is like the closest thing to the fountain of youth.
Oh.
And there's so many new things. I mean, we've been doing it since 2017 and so many things have changed. But I have noticed recently it's exploding everywhere you look. And people are really searching out and they're just really trying to find something that can help them make their day a little bit better.
Right. And so why not share with everybody, like what was a little bit of your background first? Okay. I mean, you've been doing this for a while.
Yes.
And then what was the road that brought you to, first of all, being a doctor and then moving into regenerative medicine? Do you mind taking us back a little bit?
Yeah, sure. So I started out with, I wanted to be a pediatrician. I love children. But what I didn't realize is most of my friends that are pediatricians, the kids are crying all the time.
All the time.
You know?
Yep.
And they don't really see them get better. And I really thrive on changing people's lives and getting them to feel better. So anyway, I was working at John Deere Tractor Works while I was in Galena, Illinois, while I was going to college.
Were you at Palmer?
Yeah.
No.
Yeah, I was in Palmer, Davenport.
That's amazing.
And that was before that, though, because I was living in Davenport, Iowa at the time. And so anyway, I was working at John Deere, and I had to pick up this 75-pound plowshare, and they have all these how to lift posters all over the place. But I was a parts picker, and you drove a Cushman little truck around that had a pallet box on the back.
Oh, wow.
And so they had 2-tier levels, but on the bottom level was a 75-pound plowshare. So I had to reach in there, and when I did, I hurt my back and I got sciatica. So they sent me to the company doctor. He gave me this little manila envelope, a small one with these little red pills in there, sent me on my way, and didn't really do anything. And so I was still hurting. I didn't know what to do. I went to my family doctor, who's a DO, but he didn't manipulate. And so he says, ooh, I don't know, we might have to send you an orthopedic surgeon, but we can give you a cortisone shot.
Yeah.
So anyway, long story short, several of the workers there at John Deere told me about this chiropractor, and I went to him, and he fixed me up, you know. And so that's kind of how it all evolved.
So you had no desire at that moment, prior to your back injury, to be a chiropractor?
No, and that didn't do it for me.
Oh, that didn't do anything for you.
So then, I bid on a new job at John Deere Tractor Works, and I got a forklift job.
Oh, that's great.
I was driving a forklift job, and someone rear-ended me.
Oh my God!
And hit me, and yeah, I had neck pain and pain into my thumb and finger, and but I went to the chiropractor for my lower back.
Wow!
So I didn't even know they could take care of a neck. So I'm like, same thing. Went to company doctor. I've already been through this route. So then someone there at work again at John Deere says, hey, you should go back to that chiropractor. They can work on necks too. So that's when finally I go, this must be a sign.
Is this
you know?
it?
I mean, the one thing he helped me with, you know, So that kind of changed my career path that way.
Oh, that's amazing. I thought you were going to say a nice young lady like was going to school or something grabbed your attention.
Yeah.
Now, you have fun fact. So, do you ever hear of Marycrest University?
Oh, yeah.
That's where I went to college.
Oh, really?
Yeah, it doesn't even
Yeah.
exist anymore.
Yeah. And then Augustana was right there.
Yeah,
Yeah.
they're still there.
Yeah,
Yeah, it's
there,
so
yeah.
amazing.
Yeah.
St. Ambrose, it's so great. Yeah. Yeah, I got my degree in nursing. No one knows this.
Oh.
I keep it top secret from all my viewers. But no, I went through the nursing program, and then our nursing program moved over to St. Ambrose. But anyhow, fun facts for the Quad City people. We'll have to post it up.
Yeah.
Okay. Okay, so that's how you got in. That's pretty amazing. Okay, so then you obviously did multiple years just typical chiropractic medicine, which most people don't realize. Like chiropractors have typically been on the cutting edge of like the beginning of the functional medicine wave, even though it might have been 20 something years ago. Like my good friend Dr. Scott, who he always said the problem was I was always dealing with people and they're coming to me just for pain, and regenerative medicine opened up the doorway to really restore and renew people. So tell us your experience.
Yeah, so it always frustrated me when I can't get someone better.
Yeah.
And so, you'd have 10 people come in with sciatica, and on average, 8 of them get better. I always wondered how I can help those other 2. And not only that, then it seemed like the results that we got on young people wasn't as good with older people. And so that's when I started looking into what else can we do for these patients. And there used to be a doctor, I'm in the Kelly Medical Building at St. Francis Hospital. I'm on the first floor, and there used to be a physiatrist on the second floor. And I did a lot of sports medicine, so he says, I've got this new treatment. And I know you take care of a lot of, I did a lot of the minor league teams in Tulsa. And he goes, I think I have something that might help you with that. And so anyway, he was talking to me about stem cells at the time, but he was doing them from the hip. So I got really excited because, he took them from the hip and harvested them. So I got really excited. I go, oh, that's amazing. I have all these older patients that have these like knees and shoulder stuff. And he goes, it doesn't work that good in older people. And obviously we know why now. But that's how I got into it. So I would refer patients to him and stuff like that. Well, then he ended up moving to Dallas. And so then I didn't have this referral anymore. And that's when I started looking into it in 2016. And we started doing stem cell treatments in 2017. And part of the reason I did it is because I had these chiropractic patients that would have to come back quite a bit.
Yeah.
Like you get them doing better, but they just had some problems keeping out of pain. So I remember that, and so I started looking into it. Well, then around 2016, it was available to use umbilical cord stem cells.
Yeah.
For that, you'd have to go outside the country, So I started looking into it. And then basically, I'm a chiropractor. I can't do that. So I just put a team together. So we have a medical doctor that does the injections, and then we also have a nurse practitioner. And the medical doctor has trained our nurse practitioner. And so they do the treatments, I do the education, and I just I'm always looking for ways to make things better.
Yeah, which is pretty amazing. So what I want to point out, just a point of clarification. So when you were talking to that doctor previously who said, well, the removing the stem cells from the hip, right? It doesn't work as well in older patients. That was back then, because now, because of our ability to get the stem cells from the umbilical cord, am I phrasing this correctly?
Yes, I see.
Yeah, now you have fresh, younger, brand new stem cells. And
Yes.
why don't you share for our audience just why is it? Because I have 7 kids.
Okay.
And I remember like when they were little, they could scrape their knee at noon, and by like 5 p.m. they were healed and jumping back on it and scraping up something else. Whereas if I get a cut now that I'm 50 on my leg, it takes like 5 days, where 10 years ago it would take a day and a half. So why is that? Can you explain that?
Sure.
Yeah.
So as we age, our stem cells don't work as good, just like our hormones, our healing, our fat burning, sugar burning efficiency. Things don't work as good. So if you're over 30 years old and you're using the stem cells from the adipose tissue or from the hip, which is very painful, by the way, then you're using stem cells at your own age. Well, if you had an injury and your own stem cells could take care of it, you wouldn't need to do stem cells. So the most vibrant cells are in the umbilical cord. I mean, they just got done creating a baby over 9 months, and children, if you have children or grandchildren, and you see them and you don't see them for 3 days and they look like they doubled in size, that's the vibrant that we're talking about. And it's like, same thing, if the kids cut themselves, they heal so much quicker. And so those, as we age, part of the aging process is our mesenchymal stem cells. They start to not work as well and they start to decline. So in the umbilical cord, they have tons of stem cells. Once you hit 30, 40, when you get up in 50 and 60, the mesenchymal stem cells go down. And I've seen some theories that they think that is one of the reasons why we're aging, because our mesenchymal stem cells go down, and that's part of the aging process. So if you have someone that's older, 50 and up, 40 and up, and they have a orthopedic problem with disc degeneration, arthritis, then you can take these. It's actually a tissue transplant. You can take these cells and you can put them into the joint, and the stem cells actually speed up the recuperative power. They just make things heal quicker. The stem cells don't actually heal them. They just wake up your immune system and they start repairing, regenerating, and putting in cushioning and viscosity and support all of the soft tissue, the ligaments, the disc, the cartilage, and the tendons.
Yeah, incredible. What are the most common reasons, and you could, I know without saying names, obviously, what are the most common reasons people come to see you for and get these treatments? And then my follow up on that, and I'm just kind of setting you up, is like, do you have like an example or a case study or two that you can share with our audience?
Oh, sure. Yeah. So, first of all, I just went blank. I'm sorry.
That's okay. So let's start with, no, it's all good. Okay. So just start with, why do people, what are the types of ailments and conditions and reasons why they come to you in the first place?
Okay. Yeah. Well, most of the patients come to us for orthopedic conditions, torn meniscus. If it's a partial tear of a labrum, a lot of these most people think are surgical cases. Like if you have a torn labrum, you got to have surgery. If you have torn rotator cuff, you have to have surgery. Torn ACL, if it's a complete tear, you have to have surgery. But if it isn't, your body's going to try and heal it. Well, as we age, it can't heal it as well, and it does heal with scar tissue, which causes problems.
And before you go into that, what are the symptoms people are?
Okay.
Because what I've found by interviewing so many great doctors like yourself is one of the key symptoms are I can't sleep. I can't sleep on my left shoulder anymore. Or I have to go upstairs with just one leg at a time. Where my left leg is good. My bad knee doesn't do it anymore. Right. So that's what are the conditions or kind of like that.
Well, first of all, we'll just start at the top of the body, right?
Let's go.
So neck pain.
Yep.
Can't turn your neck. Can't check your blind spot. When you sleep at night, when you lay on, the pillow a certain way, it might hurt your neck, so you got to turn over. Shoulder, lower back, sitting down increases the pain. When they sit down and they go to stand and get up, it takes them a couple steps to get going. People that have sciatica, people like you talk about, they can't go for long walks. They can't go grocery shopping because their knee or their back hurts them. They can't get down they can actually maybe get down on the ground, but they can't get back up. Which
there's been studies that have shown that your inability to sit and get up is more likely to have accidents where you fall and hurt, even broken hips or even,
Well, we have patients all the time that come in and they say, they have something wrong with their ankle and their balance is off, or they'll catch it on something. They'll be walking and their knee gives out them and they fall down. You get that zinger in the hip, and I mean, it's just things like that that kind of people will put up with.
Yeah.
Then it gets to the point where, man, this is really affecting me and I need to do something.
Right. And so traditional means nowadays is what we like to say is like putting the hand on the burner.
Yeah.
And so traditional medicine will go right down the road path to the glide path to surgery, right?
Yes.
Like pain meds and and then you think your only option is, oh, I got to get surgery on it.
Yeah.
Cool. And now share, where do we come in with regenerative medicine?
Yeah. Well, I mean, along that line, they're covering up symptoms.
Yeah.
And basically the reason for that is there's not much they can do for them. They're just going to cover up the symptoms, help you get through the day. I mean, they're taking medicine, if it wears off, or they've done cortisone injections, but, Mayo Clinic says, they should only have 3 cortisone injections in that joint in their lifetime.
Oh, is that right?
And we have people that have it, and the reason for it is because long-term use will damage the joint. It can get,
worse.
Muscle cartilage and stuff like that. So then what they say is when it gets so bad that you can't handle it, give us a call and we'll fuse it or we'll replace it. So that's where, we want to, I mean, the surgery is obviously painful. There's also risks with surgery. But what we want to do is give people a natural approach that you're not adding anything, you're not taking anything from the body. There's literally no side effects to it. But the upside is just unbelievable because, when people tell us like, I can get back up now, I can go and, throw the ball with my grandson, or we used to travel, but I can't walk, especially in Europe and the cobblestones, stuff like that. It's like, there's no way I could have done that. And we have a lot of patients, that'll come in and go, we're getting ready to go on this trip. Do you think I should do it like after? I go, well, when are you leaving? Oh, in 3 months? I go, no, let's do it because I think we can affect a change. Maybe not a lot, but we can have you on the way there. And I think you'll be able to enjoy your trip a lot.
Yeah. Now, what are some of the results that you're finding? And by the way, let me just point this out. Can you share like what the procedure actually might look like or feel like? Because it's way simpler than...
Yes. Yeah. Well, most people have had a cortisone injection.
Yeah.
And cortisone is pretty thick and grainy. They have to use a pretty big needle. And when they put it in there and then they move it around, it's very, very painful. This is not that. This is, the cells are microscopic. We use a very, very small needle. We use ultrasound guidance so that the doctor or the nurse practitioner has precision placement of the cells.
Oh, that's great.
And it's basically an injection that takes maybe 15 to 20 minutes. It actually takes more time to thaw the cells out.
Oh, wow.
And get everything ready and do the chart notes. The injection, if you just imagine a cortisone shot, except for with them digging around in there, they just put it in there like that, and it's done. 15, 20 minutes.
Yeah, it's not painful at all.
No.
Now, did you say you're doing that under MRI?
No, we use ultrasound guidance.
Ultrasound, thank you.
Yeah.
That was why I wanted to bring this up because especially when you're going after joints or very location-specific treatments, it's important that that you see someone like Dr. Roadhouse who is going to make sure that it's in the right location because stem cells will go to where there's the most damage or the closest path to damage. So if they're just doing a natural full body, what would you call it? Injection, it's going to go to, like, you can't just put it in the arm and expect it to go to your knee because it's going to find places to start healing before it gets there. Isn't that accurate or something like that?
Yeah, I mean, the whole inflammatory process is there's a damaged cell.
Yeah.
Right?
Yeah.
And so you're healing the way your body, where that injury is, sends a signal up the nerve, spinal cord, the brain, go, oh, hey, healing cells, we need to go there and help heal. That's the way it works. You don't even think about it. It just happens naturally.
That's right.
And so you want to put the cells where they are in there. So then what they do is when they're inflamed and so on, and we don't have patients do cortisone shots for a month or any anti-inflammatories, whether prescription or over the counter, because the cells have to scream. And that's the pain and inflammation. And that's what makes the cells stay there.
Amazing.
Yeah. And then they they start fixing things that are in the area.
That's amazing. Okay, so let me cover. I've asked a lot of questions. Okay, I'm sure I'm missing some. So, what would you say are some of the most commonly asked questions of patients that come into your clinic that they might be asking you that I haven't asked you yet?
Well, they want to know, like, is it safe? And we kind of talked about that.
Yeah.
They want to know, if they're not from aborted fetal cells,
Okay.
which President George Bush made illegal, so you can't use those in the United States.
Yeah, that's great.
And then they want to know, can I get any diseases, like the person that donated them? Can I get any diseases from them? And the FDA has a strict policy on, procuring the cells, storing the cells, testing the cells. So they actually test the mom and the baby, the mom first, and then after the birth, they test the mom and the baby to make sure that there's no infection.
Yeah.
And then they ask, well, like, how can I use someone else's stem cells?
Oh.
And it's like, well, because they don't have HLA, human leukocyte antigen. And that's the one that if someone gets a heart transplant, that they have to take those anti-rejection medicine. Well, they don't have that. So anyone can use those.
Cells, the mesenchymal
stem cells from the umbilical cord.
That's so good.
Do not have them. If you get them from other sources, they do.
Yeah.
So I couldn't take them from my hip and give them to you for your knee.
Yeah.
They would reject them.
Okay.
And the other thing is, when do I start seeing results? And, that kind of leads me into the other question that you were talking about. I have two cases that I can talk about. And one of them was a gentleman, 78 years old, and he had a problem with his knees, bone and bone. He wanted to do silver sneakers, but he couldn't do it anymore. He couldn't hardly walk. And so he came in, and after we did the workup, Dr. Johnson said, yeah, he's an excellent candidate. We're going to go ahead and treat him. And so he got very, very slow results. And it was 11 months, and he didn't have a whole lot of improvement. And then one day, after 11 months, he went to bed hurting, and he woke up, and all the pain was gone. Oh. And he didn't tell me about it for 4 weeks. Yeah. Because we check him, every month. He didn't tell me about it for 4 weeks because he was afraid he was going to jinx it, But most people see results within 4 to 6 weeks. Now remember, they're regenerating, they're growing tissue, so it's not as fast as covering up the symptom with a drug or cortisone. And then I had another lady who probably, it was interesting because I was at lunch 2 weeks ago with my wife. We have this favorite restaurant in Tulsa that we go to. And so anyway, I was sitting there, I go, oh my gosh, that's Marilyn. I haven't seen her in a couple of years. And Marilyn had like one of the worst backs that I'd ever seen.
Oh, wow. No.
She'd been told by, I think she said, anyway, I saw her and I said, Marilyn. And she came over and my wife was with me. And so she just was telling my wife, your husband, the clinic, they saved my life. She goes, I worked at St. Francis and my husband would have to drive me up as close as he could because to get there to go to work every day. Right. I mean, I couldn't do anything. And she actually was still hurting 18 months later. Yeah. And 2 years goes by, and that was in 2019, and all the pain is gone and hasn't come back. Wow. So those are kind of some, but I think the reason for it taking longer is because they have more damage. So people that come in and they're younger and they don't have as much damage, they're going to see results a lot quicker than someone's older. But yet I had one lady, 83 years old, she came in, we did her hip and her low back, and she got results within 4 weeks. When she came back at 8 weeks, she was really excited because her hip and low back was doing great. But she said the most important thing is her irritable bowel was gone.
Oh, there you go.
And then we have people who've done their necks and their reflux goes away. Or something,
well, that makes
because
sense.
They heal. They heal.
And
we try to put enough cells in there in case they have something else going on that they won't leave and go somewhere else. They'll stay in that area.
Yeah. So how would you describe, like, if I'm sure some people say, like, well, what is the cost range or investment range into stem cells? Obviously, insurance does not. That's the downside. Like, so insurance does not cover it. But we always have to point out, like, what most people don't realize is that even if you go get surgery, you may still be between hospital fees and all these other stuff. Even if insurance covers the majority of it, you still may be coming out of pocket a certain dollar amount that's not cheap, right?
Yeah.
And that's just, and also the lifestyle stuff. So what are the ranges that I would anticipate if I came in to look at stem cell treatment?
Well, I mean, it all depends on, the patient, how long they've had it. I mean, obviously we go through all that, but then every year I kind of look at what the averages are.
Yeah.
And depending on if they, don't have a real bad problem, if they have a big problem, what I've seen is it averages between $5,500 to $13,500, somewhere in the range.
That's right.
And obviously, the more damage you have, or if you have both knees as opposed to one, or both shoulders,
right,
or if you have a neck problem, you have a back problem. So there's a wide variety of it. And we have a lot of patients that, they'll come in and do their knees, and then, 2 or 3 years later, they do something to the shoulder, and they come back and do that too.
Yeah. Yeah. So that's good to know. And I always like to tell people, like, then that's going to cost me. But I always like to say to people, like, well, it's already costing you. You've already paid for it. Yeah. Like, you're with life, how you're feeling on a daily basis. Like, every day that goes by, you're losing out. It's costing you a lot more than just money. It's costing you freedom, energy, confidence, all those intangibles of life that make life worth living, right? So you got way more than that. And some people just push off the vacation 6 months or 3 months and make this a priority prior to the vacation. So just kind of giving our folks a little bit a way to think about that. Now, what else? So Regeneration Nation Tulsa, right? It's a cool name. Thanks. I like the website. It's the domain too, by the way.
Yeah.
So what else are you, exosomes, mesenchymal stem cells are one form of regenerative medicine. Mm-hmm. So is there anything else that you're doing in your at your practice that you'd like to share with the audience on that you're proud of and excited about?
Well, yeah. So I live in Tulsa, Oklahoma, and every year Oklahoma is ranked in the top 5 worst places to live for allergies. I've lived there 40 years, and
I was just gonna say, what's your sports team there? Is there one?
Let's see. There's the Tulsa Oilers.
Okay.
That have been around for quite some time. They're in the East Coast Hockey League. Mm-hmm. They're Tulsa Drillers. Several of the guys in the pros played for the Tulsa Drillers.
Okay, so cool. You got some,
and there's a soccer team,
and we got some up and comers, right?
Yeah, right.
All right, I love it. Okay, so there's allergies is a big deal.
Yeah, so it's the worst place to live. It's always in the top 5, and so I'd have patients say, "Hey, can you get me into an allergy clinic? Because if it's not something that I can take care of, that's why I'm over at St. Francis. I've referred from the beginning. If it wasn't something I could take care of, I tell them if I can't help you, I'll find someone that can, or at least send you to the path where they can help with that." And so when I called around, because they said, well, I can't get in there for like 6 months. So when I had my staff call around, and sure enough, it takes a long time to get them in there. So we started doing the allergy clinic, and we're one of the few allergy clinics that people's time is so valuable. Yeah. And so a lot of times in Tulsa, because the allergy is so bad, they have to come in twice a week for shots. And the testing itself that most allergy clinics do is where they stick with the needle with the antigen, and they stick in your back 120 times. It's very painful, and then you got to go home. You got to wear these bandages on your back, and you can't shower, you can't itch, and so we do testing on the arm, and it's not painful at all. Like if you close your eyes, and we do 10 at a time, and we get the testing done. And at that time, we get the results in 20 minutes. They welt up. our nurse practitioner, allergist, grades them. And when they're done, they have all these welts. We just put Benadryl cream on there. They go away. So then...
So it's not painful. Maybe a little irritable at first, just because
just
you're
the
just
itching.
getting the
But the
response.
test, but the test
it's
itself,
quick and
compared to what everyone else does,
Yeah.
is long and drawn out, and it's painful. So the other thing then is that then we do a finger stick because we want to be very thorough. And if pollen is up right now and you have a problem with ragweed and ragweed's down, it might not show up.
Yeah.
So we do a finger stick to make sure what all your allergies are during times when they're not blooming. And then we can do shots in the office. The staff can train them how to do shots at home, or they can do sublingual drops.
Oh, wow.
So for people and kids that don't like the shots, you chase them around the clinic, they don't like that, they can do the drops.
Wow.
And also, if you do the drops, then you only have to come in every 2 months and get your next dose that you do at home. So other than that, but our real focus is the regenerative medicine. I mean, that's the thing that gives me the most amount of pride and pleasure, just seeing people getting better.
Yeah, that's great. And you're going to be doing some free workshops and lunch and learns or dinners,
Yes.
or that's
I'm doing
amazing.
dinners. Yeah, I just started scheduling those.
Yeah, and is that what's the goal of getting out into the community? And
Well, I used to do them
Okay.
probably 2018, 19, just because there were so many misconceptions of what stem cells were. And it was amazing when I would get to the venue and I would say, okay, who here knows anything about stem cells? Hardly anybody would raise their hand. So it's just informative. And so if a patient comes into our office, if we have to spend an hour talking about all of these things, fetal stem cells, it would take like a 4-hour appointment.
Everything we just talked about.
Yeah, everything we just talked about. Yeah.
Yeah, that's right.
Yeah. And so basically it's an education, and a lot of people don't know what they do and what kind of conditions it can help with. And the big thing is, like we said in the beginning, stem cells is exploding. They don't realize what's going on behind the scenes. Like stem cells were first started to be studied in the 1950s, but then someone put a kibosh on that. I'm not sure who that was.
Yeah.
But we have an idea.
Start with the big, and then last thing, pharma.
Right, yeah. So then the research kind of stopped. But now in the talks, I mean, Cedars-Sinai, Mayo Clinic.
Yeah.
I mean, other countries are doing all, and the research.
right.
So when people come to the talks and they see that, they're like, what? This isn't some fly-by-night thing. This is something that's real. And there's so much research going on behind the scenes that the public does. And I mean, I think there's over like 4,000 research articles talking about the benefits of stem cell from all kinds of conditions. I mean, they're doing, we just do orthopedic, but they're talking about Parkinson's, Alzheimer's, cancer, all these different things. But those are research studies.
Yeah, we should make it just a quick disclaimer. We're not claiming that stem cells can miraculously heal any of those things.
And we don't treat any patient anyway.
But what is important to understand is that there's so much research now going into those categories where there wasn't before.
Right.
So that just shows that the results we're seeing in so many of these other areas is now really accelerating. It's great. It's great.
Well, I've known that people with disc injuries do very well with regenerative medicine and umbilical cord stem cells. But there's actually research now that says on degenerative discs and both. So that's pretty exciting. So that's something that when I was talking in 2019, we really didn't have research, but now we've got all those years where they've been doing studies and treating patients, and it kind of backs up what we're seeing in the office too.
Pretty amazing. Yeah. It's pretty amazing. Great. Now, how would, if someone wanted to come in to see you, I know we have regenerationnation.tulsa.com.
Right.
Obviously, you can go right there.
Yeah.
Call your number. How does it work? Do I come in for a free consult? Do I have a small payment? What does it look like?
Well, usually, it does take a lot of time, so the consultation's usually like $289.
Okay.
But one of the reasons that I do the talks is because if I can educate them there, I don't have to spend as much time with them.
Yeah.
So when they come to one of our talks, we give them, a gift for coming in, that we do a consultation records and make sure that they're candidate for care. we do it for $20 if they come to one of the talks.
Oh, really?
So if you're interested, come to one of our talks.
Yeah, you know what we should do? Yeah, we should possibly have an add on a little video on top of this. That's one of the talks if they can't make it or something like that. And and they check a box saying, I watched the entire Dr. Roadhouse video.
Yeah, so can I get one of those $20 consultations? Good job. Yeah,
baby.
yeah.
Let's go.
That's a great idea. Yeah.
A pain away.
Yeah.
Cool. We'll figure that out. So, okay, so you can call the office. Find out when the next talk is if you want to come see Dr. Roadhouse live on tour. It's pretty amazing. And then the other option will be just come directly into the office and see him one-on-one. And is there anything else? I mean, you're a father of 4, one wife all those years or what?
No.
Okay, we'll cut that part out.
Yeah.
Are all the kids from the same wife or no?
3 from the one.
Oh, that's amazing. Okay, cool. No, that's amazing. Blended's amazing.
Yeah.
And you're in Tulsa. Why are you in Tulsa?
Well,
why did you stay there? There's so many places you can live. So what's special about where you're currently at?
Yeah, well, I mean, I love the ocean. But one of the reasons I went to Tulsa is because at the time when I was in chiropractic college, I was in Davenport, Iowa, and I was working at John Deere. Well, in the 80s, they went through a terrible thing with agri-industrial, and the unemployment there was 23%.
Was it really?
Yep.
Wow.
And so it was hard times for a lot of people. And so when I left there, I started looking at things that I wanted. The only thing that Tulsa doesn't have is we don't have like a big pro team. We have semi-pro. That's the only thing. Otherwise, it's got everything.
Yeah, it's perfect.
It is. And so I was able to take the Oklahoma board right after I graduated. So I was planning on practicing in California, Florida, Arizona, Colorado. And I had all those boards signed up to take.
Yeah.
So when I went to Tulsa, I was expecting, wagon wheels and, cowboys and just farm town. And when I went there, I mean, they have a beautiful skyline. They got great buildings. So everywhere that I went, the one thing that Tulsa didn't have that everybody else had was traffic. So
Isn't that unbelievable?
Yeah, so you can get around. So I live 5 minutes from the hospital, and anywhere else, to take me 2 hours to get to work or something like that.
That's right.
But it's just a great place to raise kids. It was a safe area. Plus I like the sunshine, and it's, sunny 300 some days out of the year.
Is that right? Wow.
And I just thought that it would be a great place to raise a family, and I've just really enjoyed the city.
That's amazing. Cool. Well, it's been great having you on
thanks for having
the show. And so everybody out there, reach out to Regeneration Nation Tulsa or come visit and see Dr. Roadhouse live and in person and ask them your questions. There's no pressure. I mean, it's a free workshop, and it's been great having you on here. And we just want to say thanks, everybody. Hope to see you on the next episode.